All right, cool. Just so you can see, we got our list of references. We're going to be rocking through. Just so you know, we got them numbered. We're going to start with the leg. All right, you can see we've been doing our homework. All right, so we are starting. I did the back half, so we're going to start with the deep gluteal muscles, starting with the piriformis. Well, I know it's not a muscle, it's a ligament. This ligament is going to be right there. Piriformis, superior glomerulis. These are going to be this one right there. We got the obturator internus. Then we've got the inferior gemellus, and then we've got quadratus femoris right here. Tendon, and then we're going to have the, let's see, the sciatic nerve is right there. Okay, we got glute max, boom, cakes, baby. Yep, schmacking it. We got glute medius right here, and then we got glute minimus is going to be deeper inside in there, connecting. I don't know if it shows, kind of like right in there. Okay, and then we've got the tensor fascia lata, going to be in here. Okay, and then we've got the iliotibial tract, IT band. All right, then we go to biceps femoris. Okay, we have a long head and we have a short head. This is going to be the long head coming on the lateral side, and then the short head is going to be right here. I believe. Wait. One sec. Yep. And then we got the semitendinous. Yep. Right in there. Then we have the semimembranous, which is going to be right here. We've got the hamstring portion of the abductor magnus, which is it's in there. Okay, abductor magnus. Then we have the vastus lateralis, which I believe is this one here. Then we have a gracilis, is this right in here. Okay, medial. Then we're going to look at the tibial nerve. This is going to be inside there. Tibial nerve. That little guy right in there. Then we're going to have the common fibular nerve is inside here. All right, we have a popliteal artery and vein right there, red artery, blue vein. Now we're going to have the superior lateral genicular. These are the vessels of the knee. So if this is the anterior portion of the knee, then we are going to see the superior lateral genicular vessels, lateral right here. We're going to have the superior medial genicular vessels, the inferior lateral genicular vessels, and the inferior medial genicular vessels, and we are going to have the anterior tibial, which is going to come down here. Okay, we have the, now are we on the front of the leg? We got the sartorius tendon, which is going to be, okay, it's in there. The sartorius is going to be on this lateral side. It's kind of like right in there. Yeah, sartorius. Then we have the rectus femoris, which is going from lateral, this one right here. Schmack it, right there. The rectus femoris. Then we have the vastus lateralis, again, right here, okay? We have the vastus medius, which is gonna be that nice thing. When you do those leg extensions, you'd be popping.
That teardrop.
That teardrop, girl, hey. And then we have the vastus intermedius. This is gonna be in there though. Yeah, well, it's in there though, all right?
We know it, we love it.
We know it, we love it, yeah. Then we have the quadriceps tendon. Boom, right there. Patellar ligament, that's going to be below the patella. Then we have the articularis genu. Oh, come back to that. The pectineus, which is right in there. That little guy right there. Okay, and the abductor longus, adductor longus. We got the gracilis, which is a bit more inside there. That'd be in gracilis. Yeah, it's in there. Okay, we have the adductor brevis. These are all deep. So the adductor brevis is attaching from here and would be connecting here. I think our model is not following through for us. But the adduction is bringing us in Okay, so we got from here to here, it's squeezing. Whoosh, whoosh. Okay, we got 3 of these muscles. We got the abductor magnus, which is going to connect from this portion of the femur up also to this point on your pubic symphysis. We have the vertical fibers, which are going to be running more straight up. There's connections that come from the femur that come like right here. And then the top part is the adductor brevis, which is coming like right there. All right, we have an obturator nerve that is right about here. Okay,
Right through the obturator foramen.
exactly, right through the obturator foramen. And we have the anterior division, which would be on the front. And then we have a posterior division, which is coming behind. All right, so then we've got, let's go to the femoral triangle. We have an inguinal ligament, which is going to be up in here. Okay, we have a femoral nerve, which is what we're seeing come through right in there. We have a femoral artery, which is going to be right there. There's also going to be, I'm sorry, this is the femoral nerve, this is femoral artery, and this is the femoral vein. Okay, the femoral canal is coming right in there. All right, now we have the femoral ring, which is going to be right in here. And then there's a femoral sheath that encompasses this set of viscera. Okay, now we are at anterior tibial artery. Right here. Okay, that's the anterior tibial artery. There's a posterior tibial artery, which is going to be back here. It'll be back in there. All right. Now we have a fibular artery, which is going to be more in front. I'm sorry, the fibula is in the back. There's 2 sections. One of them goes here, and then the fibular artery comes to the side. I don't know if this model is showing it, but what it should be is coming off right around here, and maybe that's what this is coming out to be. Okay. Let's take a look here. This is the tibial nerve. All right, right in there, tibial nerve. Then we got the gastrocnemius medial head. In here, these are velcroed. And then we have a gastrocnemius lateral head, which is going to be here. I'm sorry. No, that's right. No, lateral head is on this side. Sorry, lateral head is on this side. All right. Then the soleus, which this is the booty. This is the soleus is under these. There, this is the soleus. All right. And then the plantaris is this tendon right there. The Achilles tendon connects here. Okay. Then we have the popliteus, which is deep right there, this muscle, popliteus. We have the fibularis longus. And this is going to be back here. Okay. No, right there. This is the fibularis longus. That muscle right there, 22. Okay, then we have the tibialis posterior, which is this 128 right there. We have the flexor digitorum longus, which is going to be this, 29. We have the flexor hallis longus, which is just next to it, 27. Posterior tibial vessels, which I imagine is this extension here. We already talked about the tibial nerve. Now let's get to the foot. We have the flexor retinaculum, which is right there, this stretch right there. We've got the tendon of the tibialis posterior. Right there. We have the tendon of the flexum digitorum longus, which is another one that comes, they're right next to each other, these 2. Then we have the posterior tibial vessels. That's going to come right behind it. You can't see it on this model, but this is going to be right inside there. You may be able to see a little bit of it right there. Where are we at? Then we just have the tibial nerve still continues down in there. Then we have the tendon of the flexor hallis longus sheath. That's going to be even under more. There's a few layers. They all just come 1, 2, 3, 4. Then we have tibialis anterior. All right. Boom. Extensor hallis longus. put our cap. No, this one has it on there.
Is this one?
Is it this one? Sorry. This goes in there? 21. Maybe right there. Nice. Okay. This would be the tibialis anterior. This next one, I just did this backwards, where the extensor hallis longus is next to it. The extensor digitorum longus is also, there's just like a group of muscles right here. They're next to each other, and they're coming down into this foot. If you take a top side look, or look at this. You see this muscle here? There's two muscles, tibialis anterior. This is the hallis longus. And then this would be the extensor digitorum. They're all just like pieces of paper. So this model doesn't show it as well as maybe a picture would, but it's freaking there. So fibulas tertius in this section, I think it's under this muscle here. There's a thing, or maybe it's this one right here. That's it. Okay, deep anterior tibial artery. Talked about this one. It's coming up from here and going all the way down. Then we have, there's a vascular twig of nerve inside of this going like across like that section there. We have the fibularis brevis, which is also a part of this group of tendons. There's some striations back there. Okay, we have the common peroneal fibular nerve. That is going to be right in there. Then we have the superficial fibular nerve, and this is going to come, it's inside of here. It's like in there. This can't come off, but it's in there. Then we have the lesser saphenous vein, which is going to be on the lateral or medial, the medial side. There's a vein that runs right about there. We have the great saphenous vein, which is going to be essentially coming through here. We have the medial sural cutaneous nerve. That's also going to be right about there in the leg. We have the lateral sural cutaneous nerve, which is going to start about right here. Okay, we have the sural nerve, which is going to be right about there. We're going to have the saphenous nerve, which is going to be right about here. It wraps around. Then we have the dorsal venous arch, which is going to be, this is the back, right, lateral on the side. There's going to be a vein that comes right through here from the top down. We have a medial canconal branches of the tibial nerve, which is going to be under the foot. It doesn't show these nerves on this, but it's going to be under there. We're going to have the plantar cutaneous branches of the nerve, and this is going to be right where the ball of your foot is. And then we're going to have the plantar cutaneous branches of the lateral plantar nerve, which is going to be right under here. Okay. Yep. Yeah.
Hey, just letting you all know, the library actually closes at 10. We have a campus-wide meeting, so we need you all to back up and return to the room. Okay?
Okay. Thank you. Thanks. All right. Okay. Well, I'll pause it.
All right, Jason here. What's up, Dr. Lunsford? We got a project here for you. You're a great teacher, by the way. So we're going to start out with the spinal nerves in autonomics. So first up is the dorsal rami. So dorsal rami, we have the dorsal root, we have the ventral root, and these lead to the dorsal rami and the ventral rami. So next up, we have the ansa cervicalis. Ansa cervicalis, you can't see it on here, but it's around the level of C4. So around here, and it kind of loops around, connecting nerve root of C1 and nerve root of C3. Next, we have the phrenic nerve. Phrenic nerve comes down from nerve root of C3 and goes down from C3. We have the vagus nerve, which you'll find not on this model, but you'll find kind of deeper, and it goes all the way down.
Out the brainstem.
Out of the brainstem. Next, we have the superior laryngeal nerve. Superior laryngeal nerve, you're going to find it here, around this, also deep, not on this model, but this guy comes more horizontal, like this, over to the larynx. Then you have the internal branch of the superior laryngeal nerve. So internal branch coming off of the laryngeal nerve and then branch down. You have the internal branch of the superior laryngeal nerve and external branch of the superior laryngeal nerve. So one of them comes down, inferior, other one comes up, superior, the larynx. Next, you have the recurrent laryngeal nerve. So it comes down a little bit further than the superior or the internal and external, and also goes to the the inferior portion of the larynx. Next, you have the hypoglossal nerve. Hypoglossal nerve, you're going to find at the root of C1, so just above C1, to be at the level of C1, hypoglossal just underneath the tongue, and it's going to go down kind of in a horizontal shape, but curved.
Right there.
Curved.
Curved.
Superior cervical ganglion, middle cervical ganglion, and inferior cervical ganglion. So they're going to be over here along the same path as the vagal nerve, or the vagus nerve, but more medial to the spine. So where there would be the superior cervical ganglion, and then so it would be more still more deep. So superior, and then the middle, and then the inferior would be even more on the inside. So more medial to the spine, or proximal to the spine. Stellate ganglion would be lower towards level of the first to second rib, above the heart. Then you have the nerve to the sternothyroid, and the nerve to the sternocleidomastoid. So the thyroid and hyoid are going to be in this level near the larynx, and so it's going to be the sternum, and hyoid, sternum, thyroid. Nerve to the superior belly, and nerve to this inferior belly of the omohyoid. So that's going to be even lower. So it's going to be around this level in there. Again, we can't see it on this model because it's a deeper structure, but in there. Next, we have the major arterial supply. So common carotid artery. We have the common carotid, internal carotid, and external carotid artery. So they're all going to branch from here. Superior thyroid artery and superior laryngeal artery are both going to be supplying the larynx and the thyroid. Then you have the lingual artery. So that's going to be way back here, up in there, and it's going to connect to your linguistics area, so your tongue and whatnot. Subclavian artery. Then you have your vertebral artery, which is going to be more down here, coming off, but deeper. You have your internal jugular vein and external jugular vein. So jugular vein,
Right next to the arteries.
yep. So then subclavian vein. Subclavian vein is going to come down here. Then facial vein. We go back up to the face and supply the face, or drain from the face. Sorry. Retromandibular vein. So retro behind the mandible. So retromandibular vein is going to be
Yep,
deeper
it's
there.
right in there.
And then anterior jugular vein. So anterior in front, the jugular, in front of the jugular, and it's going to again drain.
And these are also going to be arteries too, right? They're going to be paired.
Yep, exactly. So all of those vein and arteries. All right, back to cervical muscles. You have the rectus capitis anterior. This will be in here. Rectus capitis anterior. Rectus capitis lateralis is going to be on the outside, but deeper. So not this one, but in
Maybe
there.
in there? Yeah, there you go.
You have the longus capitis, which is this bad boy right here. Longus coli is going to be, so if this is longus capitis, here's the longus coli. All right, scalenes. You have anterior, middle, and posterior scalenes. So you have those anteriorly in the middle and then posterior. So kind of hard to see, but they're a little bit deeper. So anterior, middle, and then posterior scalene. You have the underneath muscles, the mylohyoid, geniohyoid, and the stylohyoid, all in here. So you have the mylohyoid, the geniohyoid, and then you have the stylohyoid, which will be the connecting piece. So mylo, genio, stylo. All right, infrahyoid muscles, you have the sternothyroid, the omohyoid, and the sternohyoid. So that's going to be these muscles underneath here. So sternothyroid, omohyoid, and the sternohyoid. All right, laryngeal structures. Use this guy. You have the thyroid cartilage. It's going to be the cartilage covering the thyroid. You have the laryngeal prominence, which is going to be in there closer to the, see better on this guy.
Here.
It's going to be in here by the larynx, but inside. So if you imagine, just start to put it back together, laryngeal prominence. Then you have the lamina of the thyroid, which is just the surface. You have the superior thyroid notch. Superior thyroid notch. You can kind of feel, thyroid notch. Inferior thyroid notch at the bottom of the thyroid. Then you have your superior thyroid horn, which there is, it's going to be right there. Inferior, superior, and middle thyroid horn, all in this area. So, or sorry, superior, inferior. No, I messed up. Moving on, cricoid cartilage. So cricoid cartilage, it's gonna be right here, one of them at least. Then you have the thyrohyoid membrane, it's gonna be these strings right here. Cricothyroid ligament is going to be right in between the cricoid cartilage. Then you have the thyroepiglottic ligament, which is going to connect the thyroid and the epiglottis.
I think it's in there.
So just underneath the tongue.
Yep.
Back there.
Yep.
And then you're going to have, let's go into the vocal cords. Not easy to see on this model, but inside the larynx is going to be the false and true vocal cord. So it'll be in here in this area, false and true. All right, we're going to move on to the thyroid gland. Thyroid gland, can see it in here. This guy right here. So right lobe, if I'm looking at that correctly, right lobe and left lobe of the thyroid, right there. Superior thyroid artery, not on this model, but it runs through here to supply the thyroid. Then you have the isthmus of the thyroid gland, and then the submandibular gland, submandibular gland, which is going to be a little easier to see on this guy. Come up right in there. All right, so better view of the scapular nerves. So you have the suprascapular artery and nerve going in here and here. You have the, my list, short head and the long head of the biceps. So long head, short head. You have the coracobrachialis in there. And then you're going to see the quadrangular space, which is going to be deeper in here. Axillary nerve is within the quadrangular space. Posterior circumflex humeral vessels. So all these guys in here. Triangular space is going to be this space in here. Scapular circumflex vessels are going to be within the scapula, near the scapula. Triangular interval. Then you have radial nerve. Radial nerve. Up here, it's going to be, oh nice. Yep, there's a radial nerve. And then you have the profunda brachii vessels, which are going to be even deeper in here. Oh, actually, in here. All right, so shoulder. Might be easier if I do this.
Looks like a salmon.
Yeah, it does. All right, so shoulder, supraspinatus. These mix me up. Supraspinatus
Gotcha. Top right there.
is this guy.
Yeah.
Then scapular spine here. We have the suprascapular nerve, which is in here. Infraspinatus. So infraspinatus is going to be
Under
deep
in
on
there,
the
yeah.
other side. Yep. Then the subscapularis is going to be
Behind.
the other flat part. Upper subscapular nerve. So
That's gonna be on top.
upper subscapular nerve, subscapular nerve, and then lower subscapular nerve.
You can see that one.
All right, moving on to the deltoid. We have the anterior, middle, and posterior head of the deltoid. Anterior.
So where is it? This is the deltoid.
Yeah, so deltoid, if I have this correct, anterior head is going to be over here,
Yep.
and then middle head is this way, and then posterior head of the deltoid, the posterior aspect. Then you got this guy again. He's heavy. He's a big boy. On him, we're looking at the trapezius. Along with the trapezius, deeper aspect is going to be the spinal accessory nerve.
Where's that? It's gonna be right behind there, like that, innervating the trap and the SCM.
Yep.
Oops.
Okay. Then you have transverse cervical vessels. So transverse cervical vessels just inside the cervicals, crossing over the cervicals. You have the latissimus dorsi, so more superficial back muscles. Then you have the thoracodorsal nerve. Again, that's going to be inside the thorax, supplying the dorsal aspect of the thorax. Levator scapulae. Levator scapulae is going to be in here.
Up here.
Is it?
Yeah, because it's elevating the scapula.
That's right. You can protract the scapula. Rhomboid minor is going to be a little bit deeper. Better see on this side. So deep to the trapezius.
This is actually right here. These ones, minor, major.
Perfect. Then we have the, back to the arm. Now it's going to be deeper. We're going to be looking at the coracobrachialis, the biceps brachii, long and short. Brachialis is the deeper muscle to the biceps. Musculocutaneous nerve is going to supply these. Then you have in here with the brachial artery, the median nerve, and then the ulnar nerve. And then the triceps. The triceps, so you have a long head, lateral head, and medial head. So triceps, long, medial, or sorry, yeah,
Lateral.
medial, and then lateral. Medial.
Yep.
Long, medial, lateral.
Sir.
Okay, the Antonius is, oh, it does come out, I don't know.
Let's move this guy. Nice to meet you.
You have the Anconeus, which is on the lateral aspect over here.
There you go.
There you go. Anconeus. Then radial nerve. It's in there too. Radial nerve. Profunda brachii artery. It's going to be in here. All right. Then we have the cubital fossa. So that's a little elbow pit, right opposite to the elbow. Cubital fossa. We have the brachioradialis, lateral border, and pronator teres, medial border. So brachioradialis, right in here. And then the pronator teres. So pronator to pronate. I just got the where it was. It's going to be over here. Pronator teres. Pretty sure that's our guy.
Get out of there.
Pronator teres. Then brachialis is going to be deeper right in here. Tendons of biceps brachii. Tendon. You're going to have, we cover the radial nerve. Then we have the deep radial nerve, which is going to be even deeper. So, over here. So deep, and then superficial radial nerve. Still
Slightly superficial.
Hmm.
And the deep one is down in there. Maybe it's like going deeper. Going deep, guys.
we're going in. Anterior ulnar recurrent artery, posterior ulnar recurrent artery, radial ulnar. And then next up is common interosseous, common and anterior interosseous artery. So not on this model, but deeper, so interosseous in there. And then median nerve right in here. Flexor pollicis longus is going to be over here. Flexor digitorum profundus is going to be this area. Pronator quadratus right in here. This guy. And then with that, you have the anterior interosseous and posterior. So anterior interosseous nerve and the vessels. So deeper in here, supplying the hand. So superficial, you have the pronator teres. On the outside to pronate the arm. Then you have the flexor carpi radialis, which is this piece right here. Palmaris longus, this piece right here. Flexor carpi ulnaris, which is this piece right here. Flexor digitorum superficialis, it's going to be in here, just underneath. You have got the median nerve, ulnar vessels. Covered all that. So supinator is going to be deeper inside here. Abductor, abductor, pollicis longus. You have that guy over here. Extensor pollicis brevis. It's going to be still deeper in here. Brevis and longus.
Right here. There's 23 and 22. Brevis, longus. Because this is the extensor, right? Then your stump extending. And long and brevis.
Cool. Okay, extensor indicus. It's going to be in here. Deep radial nerve, covered that. Posterior interosseous nerve, and vessels are both in there, which we already covered. All right, next, brachioradialis. Brachioradialis is going to be up here. It might be this one, actually.
That's it.
Brachioradialis. Got it. Extensor carpi radialis longus. It's going to be this guy, 18. Extensor carpi radialis brevis. It's going to be,
I think this is the longest and this is the brevis. The brevis is typically like more distal.
that's right. Okay. And then let's see the extensor digitorum. Should be a little bit lower. So digitorum is going to be over here. Extending the digits. Extensor digiti minimi. Maybe closer. Yeah. Extensor carpi ulnaris. So this guy. All right, next we got the radial artery. It's going to be deeper in there, but right here, radial artery. Tendon of flexor carpi radialis. Flexor carpi radialis. Here. And then tendon of palmaris longus. So this would be tendon of palmaris longus. If I'm taking too long.
It's all good, no worries.
All right, tendons of flexor digitorum superficialis. And they continue on this guy.
Continue on which one?
And this guy connects here. Ulnar nerves and ulnar vessels. So going to be still in there, supplying the ulnar side of the forearm and wrist and hand. We have flexor retinaculum. So flexor retinaculum is going to be in here. Median nerve. You got the tendons of flexor digitorum superficialis, profundum, or sorry, the tendons of flexor digitorum superficialis and the profundus. So superficialis is going to line right in the middle, and then the profundus or profundi are going to be on the outer sides. Hope I'm getting that right. Tendon of flexor pollicis longus. It's going to be hard to see on this guy, but deeper inside there. This guy into there. And that connects right in there. Then you have the palm. Palmar structure is deep palmar arterial arch. Right in here, if I'm not mistaken. Deep branch of ulnar nerve. It's going to come up over here and go deep. Adductor pollicis is going to be in here. Palmar interossi is going to be in here. Dorsal interossi is going to be closer to the dorsal aspect.
Yeah, so on the back of the hand.
Yep. Superficial palmar arterial arch is going to be up here. Common palmar digital nerves, so all the digital nerves and the arteries to go along with it. Then you have your lumbrical muscles in between each of the metacarpals, metatarsals.
Carpals. Tarsals of the feet.
The more you know. The more anatomy classes you take. Abductor pollicis brevis is going to be in here. Flexor pollicis brevis is going to be in here. Or abductor, so it's taking it away. So it's going to be more on this aspect. Flexor pollicis brevis is on this aspect. And then opponens pollicis, it's going to bring your thumb over to your pinky side. So it's going to be in here. And then you have superficial and deep ulnar nerves to complete those. And the palmaris brevis. You got the superficial deep ulnar nerves, and then you have the palmaris brevis in there. You have the proper palmar digital arteries, dorsal digital nerves, dorsal digital vessels. So proper palmar digital arteries, again, are going to supply the digits. Then you have the dorsal digital nerves, dorsal digital vessels. All right, moving on to the lumbar plexus. All right, so next up we have the axillary artery. So axillary artery is going to come all the way down here. It's going to branch off into your superior thoracic artery. Is in here, superior thoracic. Then branches off also to the thoracoacromial trunk, where it branches off. Then the acromial branch to the acromion. You have the deltoid branch. It's going to branch off into the deltoid, supply the shoulders. Clavicular branch, going to branch off in here and go to the clavicle. Pectoral branch, going to go down into the pecs. Then lateral thoracic artery, that's going to go into the outside wall of the thorax. You have your subscapular artery. Subscapular artery going to be more in the back, supplying the subscapularis and whatnot. Scapular circumflex artery is going to supply. It's going to wrap around and supply the scapula also. Thoracodorsal artery. So thoracodorsal, so the dorsal aspect of the thorax. Then you have the anterior circumflex humeral and posterior circumflex humeral. So both of those are going to be in here, and they kind of branch around posteriorly and anteriorly. Axillary vein, axillary sheath. So again, inside the axilla or the armpit, you have muscular compartments. You have, coming off of here, is going to be the long and short head of the biceps.
Here, hold on. Let's just use the bicep thing.
So now we're going to go over the brachial plexus. So we have the C5, 6, 7, 8, and T1 nerve roots. So nerve roots from the C5 nerve root. The nerve root's always going to be the cervicals above. So C5 vertebrae, C5 nerve root contribute to the phrenic nerve. Then you have the long thoracic nerve. You have the first intercostal nerve. Then we're going to go to the trunk. So dorsal scapular nerve, suprascapular, and then nervus subclavius. And you have your superior, middle, and inferior portions. Next, you have the divisions. So we're going to go anterior, posterior, and medial. So next, we're going to see the cords, which is the first one up is the lateral pectoral
Branch.
Lateral pectoral branch. Then we're going to have the superior subscapular branch, inferior subscapular branch, and the thoracodorsal branch coming off of the posterior. Then from the medial, it's going to be the medial pectoral, the medial brachial cutaneous, and the medial antebrachial cutaneous. Then we have the terminal nerves. So musculocutaneous branch, axial branch, and then here is the classic M structure, going to the median, radial, and the ulnar nerves. Then so yeah, covered the nerve roots, the trunk, superior, middle, inferior. Then got the divisions, anterior, posterior, superior trunks, and then anterior, superior, anterior, posterior, middle trunks, anterior, posterior, inferior trunks. Then we went over the lateral cords, lateral, posterior, and medial cords. Then musculocutaneous, axillary, all the good stuff. So next part up is going to be the axillary artery. So we need blood. This is sorry. So we have next up superficial cervical nerves. We have the lesser occipital nerve, greater auricular nerve. So lesser occipital is going to be supplying your occiput. Lesser auricular nerve is going to be down here, supplying your auricular areas, nerve glands. Spinal accessory nerve, deeper in here, supplying your trapezius and whatnot. Speaking of trapezius, we have trapezius muscles. We have the sternocleidomastoid. Then we have the platysma, neck strings.
Yeah.
Easy to see on this guy.
Yeah.
You'll go through this next because Sorry, man, stop it.
My own foot.
Let's do it.
Okay. All right, guys, here we go. Now we're going to talk about the dorsus pedis artery, which is coming right here. There, you can feel it right in there, juicy. Nice little juicy vein right there, or artery. Lateral tarsal artery, which actually, this is the dorsal one, and then this is the tarsal one right there. And then we have the medial artery, which is going to just branch off slightly this way. Then we have the arcuate artery, which is going to be like this right there. You can feel it. It's a little U shape. And then the dorsal metatarsal artery is going to be like right in there. Then the dorsal digitaris artery is going to be here. Next, we're going to go to the abductor hallucis, which is going to be a nerve that is going to take the toe and push it this way. We got the flexor digitorum brevis, which is just going to be slightly higher. I'll use this little pen right there. Then we got the abductor digiti minimi right over here, bringing it in. Medial plantar nerve is going to be right over here. Lateral plantar nerve. I'm sorry, wait. Medial plantar nerve is going to be down in here. Lateral plantar nerve, and they're going to be accompanied by the medial plantar vessels and arteries and the lateral plantar vessels and arteries. So we got the lumbricals of the foot, and like the hand, there's going to be these little muscles in between each of these little metatarsals that connect the metatarsals. The tendons of the flexor digitorum longus, which is going to be kind of like in the middle of the foot, going to be like right in there. Then we got the adductor hallucis oblique head, which is going to be in the foot, like medial, kind of like we went like this. Then we have the transverse head, which is going to be on this side here. We have the flexor digiti minimi brevis, which is going to be right in there. Plantar interossi. We have under. Then we have the dorsal interossi. And then we have the plantar arterial arch, which is going to be like an artery essentially that goes curved like this. And then there's going to be the deep branch of the plantar nerve. It's going to be very similar. Now we have the long plantar ligament, which is going to be like right in there. Then we have the short calcaneocuboid ligament, which is going to be in here. And then the spring calcaneonavicular ligament, which is going to connect like our
Calcaneus to the navicular.
yeah, right over here. Okay, and now we're going to go to the face. Now you guys get to look at my pretty face. All right, we got the trigeminal nerve is coming right on the zygomatic arch, and there's a trigeminal ganglion that's happening right about here. We have an ophthalmic division, which is going to be like right in this like fossa. I'm not exactly sure what it's called, but we have the orbital, but that ophthalmic branch is going to be right here. We have a maxillary branch, which actually goes into the orbit and then down to the maxilla up here. We have the mandibular division, which is coming from this way, right in here. Okay, then we got the zygomatic branch of the facial nerve, which is going to be coming through right in the eye. Then we have the buccal branch of the facial nerve, and that's coming more towards the corners of my mouth, cheeks. Mandibular branch of the facial nerve is coming in here. Then we have the lingual, greater and lesser palatine. So that's going to be like supplying the palate, but it's coming like through like that. Then we have the lingual nerve, does that stuff. Tell your wife about it.
Or don't.
or don't. Inferior alveolar nerve, that's right in, essentially like in the middle of the jaw, and it supplies the teeth. Mental nerve is going to be right here. Infraorbital nerve, which is going to be like kind of down in there. We can use this guy. I like using my face. I think that's cooler. And then we got the supraorbital nerve, which is going to be above. We got the supratrochlear nerve right in here. Hey, oh hey. The zygomatic temporal nerve. Okay. Then we have the zygomaticofacial nerve. Right in there. Submandibular ganglion. Won't be down in there. How about this guy?
Submandibular.
No, I don't have it, but it's gonna be right in there.
Right, sub to the
Right,
mandible.
right sub to the mandible. All right, facial arteries. We got this facial artery that comes right here into like this area, right there. Superior labial artery
The
is going to
lips.
be labial, like the lip, that lip. Inferior labial artery, lateral nasal artery. Okay, right about there. Now we have the superficial temporal artery, which is going to be on the outside of our head. Occipital artery is going to be back here. Then we have the posterior auricular artery, which is going to be kind of like where my ears are, like right up there. Yep. And then we got the maxillary artery, is right about here. And then we have the transverse facial artery which is like under the zygomatic process.
Great.
Okay, we're in a new place. Can you see? Wow, we fucking sold this place out. Everybody's coming around to figure out what kind of muscles we have for facial expressions. All right, so we got the occipitofrontalis. Guess what? Right there, frontalis, occipito. Makes me go like this. Okay, the front belly right here, back belly right there. Now we got the procerus. I'm gonna zoom in really quick. Procerus right there. I don't know what expression this does. It goes furrows maybe like that. Furrowing. Now we got the orbicularis oculi right here, like that. They're like this. Nice, good catch. And then we got the orbital part, which is right here, right there. And then we have the palpebral part, right? Oh, poke myself in the eye, right there, right there.
In the orbit.
In the orbit, A. And then we got the nasalis right here, something like that. Levator, labii superioris, aliquae nasi. Just in case you thought about that, it's right there. So next time you see your wife, you could be like, hey, baby, you got a pretty good levator labii superioris aliquae nasi.
Getting lucky tonight.
Getting lucky tonight. Zygomaticus minor. Okay, so we got the three muscles, like one right there, and this is the zygomaticus minor right there. So I imagine it's like that. Zygomaticus major. Actually, the minor's in the middle. I'm a liar. Then the major is right here. Minor is right there. And then we got rhizorius muscle, which is right here. The Koreans have a letter that goes, that's what they do. The pressure septi nasi is right in there. We got this big like muscle ring, which is called the orbicularis oris, and the rhizorius is like behind that. The depressor anguli oris, right here.
Side muscles.
Mine don't work. I'm never fucking sad. Depressor labii inferius is right here, and the platysma. We had our beautiful young cameraman right there showed us his platysma earlier. Our mentalis, front cut, masseter. That freaking, I wish I had used that because it's freaking 4 o'clock and we've been here since 9 o'clock. Haven't used my masseter at all to eat food. Mastication. I got my buckinator, my Wendy's buckinator. Yeah. We got the oral fissure right there. And then we got our parotid duct and gland right there. Can't see it, my beard's too hairy. My levator labii superioris cut right under this orbital palpebral part right there. That's a little baby muscle. Palpebral fissure, meaning my eye hole, my eye slit. My temporal fascia right there. It's going to be right in there. And the corrugator supercilii, which is like, you got this frontalis one, you got this orbital, and this one fits right in there. Okay. Help you raise your eyebrow. All right. We already talked about the masseter, mastication muscles. The temporalis is this thing right here. Squeezing it. You can feel it when you bite your teeth down. And then your medial pterygoid, which is like in front of the jaw, kind of right there. And then you have the lateral pterygoid, which there's a bunch of muscles in here. You have like pterodactyl, Terry. No, if you don't know Terry, pterodactyl is good. All right, so there's a few muscles right here. Okay, we got the superior head of the lateral pterygoid muscle. Connects on the top of the freaking jawbone, but that's not what it's called later on that. It connects to right behind your orbit. Then you have the lateral pterygoid muscle, which is like just under that. Then you have the inferior head of the lateral pterygoid muscle, which is just a bit lower. Actually, I'm sorry. Yeah, we're going from here up there. Next one's down here, lateral pterygoid muscle, inferior head of the pterygoid muscle. Deep head of the medial muscle actually goes more like this way. Then we have the pterygoid muscle, which is like that, and then we have the lateral head of the superficial head of the medial pterygoid muscle, which is kind of like this. How about that? Chew that up. Yeah, you masticator. All right. Now let's talk about our eyes, los ojos. We have that superior rectus, that's helping me go like this. Then we have the inferior rectus, which is helping me go like this. We got the medial rectus, which is helping me go like this. And then we got the lateral rectus, which helped me go like, I can't do that one. We got a superior oblique, which, maybe is like that. Then we got the inferior oblique, and then we got our trochlea, which, hey, that one is all swizzled up on the inside. There's a couple of little ligaments. One is the superior oblique, and then the trochlea. They kind of stick like that right there. Then we got the optic nerve, which if you imagine my eye, we got this eye. This is the eye, okay? This would be the freaking pupil. Iris, yeah, pupil iris, thank you. And then now if we turn it to the side, now we can see that this would be like the whole eyeball, and then right in here would be the optic nerve. all the light goes into our iris through the retina, into the optic nerve, into our brains, and then we get to see what the hell is in front of us. Now we got the ophthalmic artery, which is going to be like, if this is the optic nerve, the ophthalmic artery is going to be like all slizzled up. That's a good word, I like that. Then we have the central retinal artery. So if you imagine that this is the optic nerve, the retina is going to have like a point on it, and that central artery is going to innervate right in the middle of the retina. Now we have the short ciliary nerves, which this is going to help our eyes focus. And then we have the ciliary ganglion, which is the nerve that innervates the eye. And it's just going to be right. Like if this is our eye again, that ganglion is going to be right where the optic nerve comes out. All right? Eyeball structures, okay? The cornea is the outermost layer of our eye. So like if I touch my cornea, it's the freaking outermost layer. So this is what would, if I touch my eye, I would be touching the cornea. The sclera is right around it's almost like a continuation of the cornea. The cornea is in front, and the sclera is like a layer that covers the entire eye. The white is the sclera. Now we have a lens, which is what helps to help us focus. The iris is the colored part of our eye. Mine are beautifully green and brown, just in case you didn't notice. Yep, see it right there. Then, yeah. If we're all the colorblind and all the podcast people, they're beautiful, just so you know. Then we have the pupil, which is the black part. Then we have the retina, which again we just talked about that, back of the eye. The choroid, which is a layer between the sclera and the. It's like a vascular layer. It's a vascular layer between the retina, or that nerve is like optic nerve, and the sclera. Then we have the anterior chamber of the eye, which essentially is like, there's a space in between your lens and the cornea that has fluid in it, and that's what is the anterior chamber. The posterior chamber also can have fluid in it. Again, all this is used to help focus near and far. We have the ciliary bodies, which are like these little strands. If my whole face is an eyeball, the ciliary bodies can pull actually from up and down to help the lens focus. Now I got the nasal cavity. All right. So we have 3 concha in our nasal cavity. And if you imagine my face was a skull, if I didn't have a nose, these concha are turning almost like a mustache. And there's one that turns this way, and there's the other one that turns this way. What happens is when we inhale, the air spins and it humidifies, and that's what these concha do. So we have a superior, middle, and inferior concha. We have an ethmoid bulla, which is like a air pocket space right in between our nasal cavity and our orbital cavity. We have the semilunar hiatus, which is the open space of that concha. So if the concha spins this way, it would be like this space right where my, what do you call this? My palm, my reverse, my back knuckles are. That would be the semilunar hiatus. We have an uncinate process, which this is what the medial concha looks like. There's an uncinate process right here. It's a bone that sticks out just like this. There's another one, boop, bone, uncinate process. All right, now we have the superior hiatus, middle hiatus, and inferior hiatus. Essentially, like if these are the concha, this is what the concha look like, kind of like that. There are these spaces that curve, and each one of these curved spaces has a name: superior, middle, and inferior hiatus. Anterior ethmoidal artery. If we cut my face in half, let's say we went like this, we just sawed me in half, and we're looking at my nose like this. I have a plate. We have the palate, and then we have this plate here that separates our brain from our nose. Okay, there are vessels that go through this part of my nose up into the brain. There's the anterior ethmoidal artery, the posterior ethmoidal artery, and then the sphenopalatine artery goes from our sphenoid bone, which is like real inside my face, and then through the palatine bone here. We have the nasal palatine nerve, which is coming from like the back of my head here, at the back of my throat. If this is the back of my throat, the nerve comes out through my nose and comes right down into my teeth here. Nasopalatine nerve. Pterygopalatine ganglion is going to be like kind of like in this part of my skull, in the maxilla. The oral cavity. Tensor veli palatini is like, if you looked up, it's going to be back in here. Levator palatini, veli palatini, yep, deep. And the palatoglossus, which is a muscle that is behind the tongue. It connects to the top. If this is my palate, There's my tongue. That muscle is behind my tongue. It's like a little thing, kind of like my finger. Right there, palatal-glottis muscle. Okay, the palatopharyngeus. If you look at my mouth, you'll see an epiglottis, which is like that little thing, and then there's going to be like 2 arches. The palatopharyngeus is the second arch back.
First arch.
Second. Ooh. And then we have the musculus ovale, which is also a muscle in the back of that part of my throat. Genioglossus. There's quite a few muscles that connect from the inside of my jawbone and then up to my tongue this way, and then back to another part of, I guess, the jaw. So we have the stylopharyngeus muscle, which connects from the styloid process to down the jaw. And then we have the hyoglossus muscle, which, if this is my tongue, and then this one's here, it connects back this way. Hyoglossal, yep. And then we have the superior constrictor and the middle constrictor, which are like right directly behind the tongue here. And I'm going to go this way. And then we have the lingual frenulum, which is that line in there. Then we have the valate papillae, which, what's on my tongue? The bumps on my tongue. Folate papillae, which is a little more, valate papillae, folate papillae, and then filiform papillae. Okay. Fungiform papillae. Oh, the fungiform papillae is the crease in the middle of the tongue. The lingual tonsil is on the lingual frenulum. There are like 2 little circular dots. I don't know if you see it.
Yep.
That would be the lingual tonsil. The palatine tonsil is on those 2 arches. There's the first arch and then the second arch. The palatine tonsil is in between the first 2. I don't know if you see it.
Yep. The first,
Uh-huh.
and then the second at the back, and then right in between those 2.
Nice. Then we have the submandibular gland, which is also right. It's like right under those 2 little dots. Yeah. And then parotid gland is not labeled on there, so give us extra credit. We know that it exists. All right, now let's talk about our ear. We got the auricle, right? That's down here. We got the auricle is here, lobule is here. The concha of the auricle is right in this like space. My ears are fucked up from jujitsu, so I don't know exactly if mine's the best one, especially this one. This one's all blown up. Yeah, let's use Jason's.
Personal identifier.
Yeah, personal identifier. Okay, so why don't you come stand right here, right there. Yes, sir.
Sunlight.
All right, so we got the auricle. He's got a hexicle right there. Then he's auricle, lobule. Then we got the concha, this one right here, and that one right there. This one's the cymba, and that one's the cavum. Then we have the hylix, the tragus is right there. This is the antitragus. Then we have the external auditory meatus, which if I stuck this pen all the way through his ear, whoops, it would go.
The other side?
Yeah. I don't know if I did that. Hold on, sorry. Hylix. These are the conchas. Yeah. And then we have the antihelix crura. We have the scaphoid fossa right in there. And then we have the helix crus right there. And then the intertragic notch, which is right there. Or tragus, intertragus notch. All right, so now I guess we have to talk about the ear,
Middle inner?
yeah, middle and inner ear. So the external auditory meatus is kind of like similar where your tympanic membrane is. We can go over here again. All right. So if you imagine your eardrum, tympanic, similar. Your external auditory meatus. This is where it all starts to create sound for the bones in our ears. Now we have our umbo, which is like a part of the malleus. And it's just like this little, looks like the styloid process in your skull. We have a pars flaccida, which I think that, hey, let's just use these pictures that we can talk about it, because let's come over here. Let's just do it like this. All right. So this is our inner external auditory meatus, and then the tympanic membrane is right in there. Now this is a view as if we were looking this way into the external auditory meatus, and this is what we would see. So when that happens, this right here is the umbo. The umbo is also right there. Then we have the pars flaccida, which is this part, circular part right there, and the pars tensa, which is right in here. Then we have the tympanic cavity. I mean, that's just the whole thing. We have the mastoid antrum, which is this area right in there. And then we have the oval window. If we look at this, this is our round window. This is like looking inside the concha, right? Our round window right there. We also have the round window right here. We have a malleus, which you can see the malleus in this section right there, that shape. And then we have this shape of the malleus right here, okay? And then there's a malleus in there as well. So now we have our incus, which is this shape right here. That is the stapes, okay? Incus stapes. Now we have stapedius, which is right in there. We have the concha, which is this beautifully shell-like bone that helps us to generate sound into our first, hearing is which cranial nerve? Is it 8? No. Back to us on that one. We'll get back to you on that one. This is our vestibule right under the stapes. The circular canals. These are the semicircular canals in the concha. All right. Then we have our ampulla, which is right in here. Ampulla is that little thing there. We have the cochlear duct, which is right there. Then the scala. Oh no, we're gonna skip those two. This is the spiral region of Corti. That's spiral. Got our saccule, our utricle, and the ampulla. Okay. All right. Now we're going back to me. Hey. All right. So now we're going to talk about the suboccipital region. Okay. We got rectus, capitis, posterior, major, and minor. So rectus, capitis. You can still hear it. So capitis meaning connecting to the skull. Rectus, erect. Okay. There's a major and a minor. Then we have obliquus capitis, superior and inferior, which is coming like almost like is this angle right here. Okay, we got the superior and the inferior. Superior, inferior. These are the angles that they connect. Now I have the suboccipital nerve, which is going to be right in between the inferior and superior obliquus capitis, that nerve. Okay. Now we have the greater occipital nerve, which is going to be inferior to the obliquus capitis inferior, so below that muscle. Now we have the third occipital nerve, which actually is going to be probably right around C3 and 4. Now we have deep back muscles. Okay, so first one is the iliocostalis. Ilio meaning connecting to our ilium, costalis connecting to our ribs. Now we have the longissimus, which connects more to the spinous processes that we have in our low lumbars, and this goes all the way to our mid-thoracics. Now we have the spinalis, which is even more medial than the longissimus. It's just a really thin one, and we're hitting high lumbars up to the thoracics. We have the semispinalis capitis, which is, I think we just talked about, oh no, we didn't. The semispinalis capitis is going to be like, if you imagine our occipital, these like ridge lines here, that the semispinalis capitis connects to that like ridge that you feel. The multifidus is, what is it? Multifidus is connecting at like the bottom of our sacrum. It kind of does this line and then reaches all the way up to mid-thoracics. So next we have, well, we're throwing these ones in extra. Back to the foot. Extra. We have superior extensor retinaculum, which is right here. It's a ligament. And then we have the inferior extensor retinaculum, which is like it's almost like sandals. When you put sandals on, it's kind of like that. They connect there. Keeps all our dorsiflexion muscles all fired up. So we're going to get our fine young friend in here. Want to do this last one?
Yeah.
Okay. Let's see. There you go.
Yeah, I'm turned on. All right. Lumbosacral trunk. So we have lumbosacrals all the way down to C1, L4, 5, S1, 2, 3, 4, 5, and C1. So the first branch, L4, you're going to find the connected to the L5 is the lumbosacral trunk. And then branching off of the S4 is 3 nerves, 1 branch, superior gluteal nerves. And then below that, or inferior to that, is going to be the inferior gluteal nerves. And so connecting the common peroneal nerves and the nerves to the quadriceps, no, sorry, to the tibialis, sorry, it's going to make up your sciatic nerve, is those 2 nerves together. And then branching off of that, you're going to go to your S1, S2, S3. They're going to make up the perforating cutaneous nerves. And then S2, S3, they're going to branch off into your pudendal nerves. And then just here, branching off of the tibialis nerve, is your nerve to the quadriceps femoris.
Cool. All right.
Killed it.
If you want us to make videos for you because we're so good, let us know. Peace out.
For extra credit.
Yeah.